Hello, everybody. So today we're going to do a post-mortem of a Atlantic white-sided dolphin, and hopefully all the technology is going to work, and you can hear this, and you should be able to get views from the camera above there, but also from the mobile cameras that we have working as well. So first of all, a word about the sort of the PPE that you need to use. Um, this is what I choose to wear. These are waterproof leggings, boots, and then a waterproof top. Um, Arm length gloves that just mean that you don't get any fluid on your skin, and a cut proof glove on your non-cutting hand. So I'm right-handed, so I'll put this on my left hand, and then just night owl gloves above this. You may choose to wear more or less than that, depending on how warm it is, but this is the sort of minimum that we wear up here. Um, it's really important that you make sure that you have gloves on at some point, and it's also a good idea to make sure that you have something to prevent stab injuries. If you come over here, you can see some of the equipment that we use. So we have a number of different knives, scissors, knife sharpener, chopping board, saws, tape measure, and obviously a camera. So it's useful if you can to have a camera that's waterproof or at least wipe-proof so that you can use it during the post-mortem. Either that or have somebody who's going to be staying clean during the process. Um, this is a sample trailer, and you can choose what it is that you take. We have pots, 60 ml pots here that we label up with the unique identifier and the tissue type, so skin pots, liver, blubber, etc. We have smaller vials that we use for the ultra cold archive, so those will go into -80. We use just plastic bags. These are IKEA because they gave them to us. Other bags are available. And just simply food grade aluminium foil, which is used to wrap the tissues that we want to use for toxicology. So these are the ones that will wrap the muscle, the blubber, for subsequent tox analysis, pens and that stuff. But everybody has their own setup and what it is that they want to use. So I'll introduce you to Nick, who's going to be helping doing the postmortem. Um, and we're going to start by just having a look at the animal. So the first thing to say is that so this is an animal live stranded. They put it into a shipping container and brought it down to us. So it's been in the refrigerator at 2 degrees for the last couple of days. We made a hole in the dorsal fin here, which is you can lift them. So if you need to lift an animal this size by putting a hole through the dorsal fin and putting a lifting strop through that, you'll be able to move them. This can support the entire body weight of them. The first thing to do is to try and put it into left lateral recumbency. So we ride the thing down on its right side, just because it's easy to be able to see through it. But we're going to try and shift it back up onto its sternum in a moment, so we can show you the body condition assessments. But whilst it's here, we might as well come and have a look. You can see we basically just start at the end of the beak, check the teeth to see if there's any broken teeth, look around the mouth for any evidence of entanglement marks. They're often very thin, quite small marks made from monofilament netting, so they can be quite subtle and they will often disappear post-mortem. So if you can get photographs whilst the animal is very fresh before they've gone in the chiller, that's useful. You can see there's maybe a couple here and here that suggest there might have been some previous interaction with monofilaments in the past. Check the eye, particularly to look to see if there's any bubbles in the anterior chamber of the eye or any bruising around it. Check the blowhole over here, see if there's any foam or fluid or sand. And then really just work your way across the animal, particularly looking for these small lesions here. That looks like a small poxy lesions, like a small tattoo lesions. We might want to take some of that for virology. Also look at anything that sort of sticks out. So this is the pectoral fins here. We're particularly interested to see whether or not there's any evidence of entanglement or bycatch. They're again, similar to around the mouth, they're often quite subtle here. So look for small cut marks around the leading edge of the pectoral fins. Going back along the flank, again, notice, photograph and measure any marks that you see. Some of them might be post-mortem chain, some of them might be scavenger damage, some of them may be significant. When we've got it on the on its sternum, we'll also check the insertion of the dorsal fin. Coming back, look for the sex of the animal. So this is the genital slit. There's the anus there, as that's some distance, that means that this is male. Females, that distance between the genital slit and the anus is much shorter, and you also potentially see mammary slits. But in this case, this is male, and you can also, if you just feel in the prepucial slit, you can feel the penis in there as well. Going further back to this tailstock, Atlantic white-sided dolphins have this rather beautiful, very stocky keel with this beautiful patterning on it, and then it very quickly comes down to the tailstock. Again, for this, you're looking to see if there's any marks or any entanglements, if there's any areas where there might be bycatch, anywhere where there's been a rope put around it, any marks on the tail fluke per se. But as far as you can see, apart from a few little poxy lesions, there's not very much on this at all. So what we'll try and do is to get this onto its sternum. So I might need a hand for this, Nick. So we've weighed this animal beforehand, and it was 170, is it? 170 kilos. So quite hefty. Yep. There we go. Well, that was a lot of effort. Okay, so the whole purpose for doing this is to assess the body condition. Ideally, try and do this whilst before the animal's on its side. So effectively, this is the layer where the spine is. So everything which is above this, here and here and here, these are just the muscles, and everything above the spine is essentially muscle and blubber and skin. So this is the body condition of it. If you come to the head end, Russ, and you look along the body here, you can see the curvature of the muscle here. So this animal's in reasonably good body condition, and it looks nice and rounded, nice and convex. You can't see the lateral spinous processes. You can't see any sort of dishing in around the head, and it's relatively robust. If the animal is in poorer condition, you'd find that there would be sort of more kind of concavity, particularly around here and around the head. And in a very poor conditioned animal, you can almost see the lateral spinous processes, and it's very, very clearly dished in. This is one of the most important kind of observations that you can make, because it will give you an assessment on whether or not the ante-mortem body condition of the animal. If it's quite thin, then that could suggest the animal's been ill for a while. Equally, if it's in good body condition, it suggests that it's been feeding successfully and sufficiently, at least up to pretty close to when the animal stranded and died. So a bit of a mission to try and get them onto their belly, but a really useful indication. And if you're doing any live animal work, then this assessment is really important as well. Just a note to say that this is the skin, which is sloughing off. That's just a function of cetacean skin. It looks a little bit like plastic sheeting, but it's just the layers of the skin. As it begins to dry out, then it sloughs off like this. In terms of measurements, there are 3 measurements that we want to take. There's a straight line measurement that goes from the front of the beak here straight the way back to the tail notch, which is there. And most cetaceans, apart from beaked whales, will have a tail notch. So we measure from the beak straight the way down to the tail notch there. It's very simple. It doesn't matter whether or not you're doing a tiny harbor porpoise or you're doing a blue whale, pretty much the same measurement. This tape measure, surveyor's tape measure, has inches and centimeters on it. We measure it in inches if you make sure that it's not. Right. So we go back here. Happy with that? Yeah. So that is tailstock 5'1". So that is 2 meters 51, 251. And the other measurements we do is 2 girth measurements. And there's 1 girth measurement we do in the basically in the armpit, just to the caudal edge of the pectoral fin, and the other is just in front of the dorsal fin here. So if you can get the tape measure underneath it, make sure it's not kinked too much. Yeah. And that is 26. I assume that's 1 meter 26. Yeah, 126. And then, so that's just there. And then move the tape measure forward. So it's just in front of the dorsal fin. Yeah, 147. Now, in this case, it's just about possible, to get the tape measure underneath it, although it's not exactly straightforward. If you have a bigger animal, it's even harder. And in which case, what you can do is just measure from the half body, so from just in front of the dorsal fin back to the line with the umbilicus on it. So you can use the genital slit and the umbilicus to show you where the midline is eventually. Pardon me. So that will give you a measurement, a half body one. If you do that, make a note that it's a half body measurement, because of where the animal sits, it won't be exactly half. And then this isn't a standard protocol, but we also measure the blowhole to dorsal fin measurement. So that's just for a small project that we have. That is 67 centimeters. Give it a bit of a wash. Okay. So I tend to do the postmortems with them lying on this side. It just makes it a little bit easier to be able to visualize things, but because they alters on the left-hand side as well. So it allows you to see the aorta, most of the liver is kept out of the way. You may choose to do it differently, but if before possible, you'll find it much easier, I think, if you can lie them in this position. So just to recap, we've measured the animal. So we've got one length measurement and two girth measurements. It might be that your projects want you to measure loads of other things, dorsal fin measurements, height of dorsal fin, etc. But those are the core ones that we suggest that you take. And I've checked to see if there's any external injuries that we can see. So I say check the eye, check the blowhole, check the mouth, looking for evidence of entanglements or bycatch lesions on the pectoral fins, on the dorsal fin, and the tail fluke. We've got a sex of the animal, and we've got assessment of body condition. So before we picked up a knife, all we've got is a camera and a tape measure, and we already know quite a lot about this animal. So we know that it's male, adult, in reasonable body condition, with no external signs of any form of significant entanglement or bycatch. And given that that's one of the major causes of death, particularly of pelagic odontocetes, it's good to at least at this stage to be relatively confident that that's not what we're seeing. Small mark there of something, but that's probably from the stranding process. Okay, so I'm now going to take the basic kind of samples that we need. Knife sharpener is really good to keep an edge on this. So what I'm going to do is just go just in front of the dorsal fin over here, and then make one incision through the skin and the blubber and slightly into the muscle. You don't need to press too deeply, and go right the way to the ventral midline. So you've got a single incision there, and then go about an inch, 2 or 3 centimeters, just cranial to that, and make another incision. So you end up with twin parallel tracks going down, and then it's possible to free up tissue ventrally. You should be able to just get your fingers in behind, so you can get a knife in, and you can cut between the connective tissue, the subcuticular connective tissue. So you'll end up with that's the skin and the blubber, which they're very closely bonded together. But you can see with just a little bit of traction, you're able to pull this back. Right the way back up to the dorsal insertion. Okay, so that will give you a strip of tissue like this. Now you can take your measurements on this strip, or you can take your measurements on this. It's entirely up to you. For the purposes of this, I'll measure on the strip because it's easier to see from the camera above. So this is the pigmentation here. That's the ventral part, midline, and the dorsal area. Thanks, Nick. So dorsal measurement, make sure you're perpendicular to it, and all you're measuring is from the base of the skin, so where the white blubber begins, down to the connective tissue. So on that, I measure that as about 25 millimeters. The dorsal bit will always be slightly fatter. Somewhere in the middle, which you can get by roughly just folding it in half like that. That will give you your lateral measurement, and that is less. So that's about, I would say that's about 17 millimeters there. And ventrally, again, a bit more. So that's about 20 millimeters. So 20, 20. You can also get those measurements off the tissue here, if you wish, 20 millimeters. Here and dorsally. But again, it's useful to take some pictures of this as well. So if you need to remind yourself. So if you spot anything that you want to take a picture of, it's always a good idea to put a ruler in it for scale. Um, it's also, if at all possible, good to have an identification of what that animal is. Now, we can do that digitally with all the pictures immediately after we've taken them, but it doesn't hurt to have a piece of waterproof card with the actual identification number of this animal written on it on most of your photographs, if at all possible, as well. So from this, you can see that there's some connective tissue, and at the moment we can't see anything particularly significant in terms of the bruising. So I'll now show you the basic samples that we're going to take from this. So normally I do this on a board, but seeing as there's a camera above, are you able to see this? Fine, good, good. So this strip of tissue will actually give you an awful lot of information. So you've got the skin, which is useful for genetic analysis, but also for stable isotope assessment. The skin uh, is is regenerated really quite quickly in cetaceans. So the stable isotopic profile of the skin represents what it's been feeding on only for the last few weeks. So it's a really useful isotopic tissue to take. Below that, you have the blubber, and the blubber is obviously useful to give you assessment of its energy reserves, but also because it's an incredibly fatty tissue, it's useful for looking at contaminants, particularly persistent organic pollutants that dissolve in fats. So things like PCBs, dieldrins, bioretardants, etc. And then below that, you have the muscle, and the muscle is again a useful tissue for isotope profiles, but also for contaminant assessments. So you don't need very much from this. You can take a chunk of tissue about an inch square. That's the skin and the blubber. So we take a couple of those. And then we also take some samples just for skin. And for those, just quite crudely take the blubber off, because you won't need that for this, and that'll give you some skin samples. Now I tend to just chop them up a little bit so that if people want a fraction of skin for genetics work, for example, it means you can just open the pot and remove a small fraction of that skin without having to defrost the whole piece. You can see the next I'm putting those into a pot. So the skin doesn't need any tin foil, that can just go in there. Mm-hmm. I'm taking a bit of the skin with the suspected tattoo lesion, which we're going to hopefully assay for pox virus. I'll give you two bits, Nick. I'll give you this bit and a bit with of normal skin. Yeah. So that's your suspect pox one. I'll give you some normal ones as well. Yeah, that for them histology. And then we'll just take some normal skin. So these are going in the ultra cold archive down at -80, so we don't need huge volumes of this. Right. So if you bring these over here. So these are, you got the blubber tissues? Right, yeah. Okay. I'll put them in there. So that we're going to wrap that into tin foil. So yeah. Okay. So a couple of bits of tin foil, and we just can wrap that in the tin foil, and then that can go into a pot. So it's a very good idea before you wrap it to write on the pot what it is that what your sample is that you're taking, because once it's wrapped in tin foil and it's frozen, you won't know what it is. So 2 pieces of blubber. So that the other piece we're going to take is some mussels. So always tend to take the mussel from just in front of the dorsal fin here. This is a deep belly of the longest of my dorsi muscles. The advantage of this is that it's a good source of muscle, but it's also, you're not going to hit anything through there. You're just going to, if you put the knife in too deep, you're just going to bounce off the bone. So it's a very safe area to sample from. There's a chunk of muscle. That's pretty normal color for diving cetacean. They're sort of dark purpley red color. Obviously, the reason it's so dark is because these have elevated amounts of myoglobin for oxygen storage. These are the oxygen tanks, if you like, of the animal, where all the oxygen is stored to support them during the dive. This is a really useful tissue for isotopes and for contaminants, particularly for heavy metal analysis, and increasingly it's been used for genetics. So in addition to the skin and the blubber, it's a really useful chunk of tissue to take. And again, because we're thinking of using this for analysis, metal analysis, we wrap it in tin foil. Now, you might think that that adds a potential source of contamination, but actually most of the assays that we use can separate whether or not it's aluminium food grade foil that they're picking up. So you need a chunk about that big, and just stick them into the middle of your foil. And that's that. Okay, so up to now we've got a bit of skin for virus assessment, because it looked a little bit like that might have been a viral lesion, pox lesion perhaps. We have some skin, muscle, and blubber, and we've got some muscle which can be used for isotope screening, for contaminant assessment of the genetics. So that's a really good set of tissues to start with, and it might be, for terms of sampling, that's as far as you go. You may not choose to take any more than that. It's also worth saying that if you're doing this on the beach, particularly if the carcass is then going to be collected. You might not want to take the entire strip of tissue out. You can obviously just take a small window there, there, and there. But it's good practice wherever possible to try and take the blubber and the muscle from around this region here. Um, you can choose where you take it from, dependent on how you've set up your archive. But it does tend to make sense to take it from this region, uh, more than just and randomly anywhere on the body. Okay, so take the blub off. So what we're going to do now is just strip off the outer skin and blubber layer along the base of the jaw, underneath the jaw, going forward along the abdomen, just around the genital slit. So back round, back of dorsally. So that's delineating the bit we're going to remove the blubber from. Already you can see the animal looks quite dehydrated. It's quite tacky. The subcuticular tissue is quite um, tacky and adhesive. It's not potentially not as well hydrated as we would have hoped. Look to see if there's any bruising in the bits of muscle you take off. Not too much here. So here we've got, this is the, delineates the scapula. So blade-like bone that is not articulated with the main axial skeleton. It just is held in place by ligaments and muscle. You can locate the scapular humeral joint, basically the head of the scapula, head of the humerus rather. There is a ball and socket joint. It's worth, when you open it, checking to see if the synovial fluid has any significant volume or pigment to it, partly because if the animals have quite a lot of trauma, you can sometimes see that the synovial fluid is changed and is much darker red in color. Reflecting the blubber from just underneath the jaw. Again, look for bruising along here. If the animal's been live stranded on the beach or on the shore for any length of time, there's often quite a lot of bruising here because this is what it will have used to essentially try and pivot itself whilst it's out of the water. And you will see that in the various different blubber pigment changes. So again, you can see here there's no significant bruising per se, but the tissue is slightly dry and tacky. This animal is not the best hydration status. Now, some of that could be related to the post-mortem changes that have happened after it died, but I think there is an element of dehydration in this case as well. Now, I'm just going to take the pectoral fin off here because this will go for the local museum. But the rest of this, once it's checked, can go for disposal. So this is just this will go for clinical waste disposal. Obviously, that's just going to be the soft tissues, and then we're going to get another bin that all the bone will go into. So speaking of bone, we come back and have a look at the scapula. So as I say, it's a blade-like bone, and you can free it up from the body wall. Now you've disarticulated it. And as you do so, have a look underneath to see if there's any obvious signs of hemorrhage or bruising in that connective tissue. There isn't in this case. So as you pull it back, if the animal's been lying on this side for any length of time, you often find that there's bruising in this connective tissue under here. And the reason is pretty obvious is that underneath here, there are the bones, the rib bones. So they're obviously quite hard and put up some resistance. This is a bone as well. So you've got muscle sandwiched between two bony structures. So if there's much force going on this from the animal being on the beach, then often you do get hemorrhage underneath this. So that can be a good indication, if you need it, that the animal might have live stranded. However, in this case, we don't see that at all. That's a pretty normal, pretty unremarkable scapular bone with a covering of muscle on both sides of it, which we'll just put to one side and use that for, I know, bins here. Okay, so we'll continue with stripping this further back. So this is about level just below the spine. Now, as you're going down here, be careful, keep the blade of your knife quite flat, because you don't want to puncture into the abdominal cavity at this stage. Again, look out for bruising. Look to see if there's any parasitic cysts in the blubber. You simply have some tetraphylidian cysts, certainly in the caudal areas. Tapeworm cysts that insist within the blubber. Actually, in this case, then. But look within here if you see any small white cysts, phyllobothrid cysts, which can be part of the intermediate stages of a shark tapeworm, and they tend to focus or be focused around the caudal end of the animal. Not sure why. Potentially because shark are ambush predators, and sometimes they will come and grab a bit of tissue from here. So it's perhaps if the parasite focuses on this region, there's a higher chance of it being transmitted into the final host. Okay, so take a little bit more of this tissue off here, but we don't need much. This will just allow you to visualize the musculature. And this last piece along here. Okay, so just in terms of looking at now we've taken obviously the whole skin and blubber layer has come off here, and you can begin to see the shape of the anatomy. So you've got the skull and the bones of the lower jaw are here. This is the hyoid apparatus buried underneath here. with the larynx and the thyroid, which we'll come to in a moment. We've removed the scapula from this region where the pectoral fin was attached, checked for bruising, and you can now see the shape of the ribs that are coming along here. So the diaphragm, the ribs extend back to this point, and then there's the diaphragm attachment that comes there. So the diaphragm is quite oblique. In addition to which, you'll feel the ribs have a sort of chevron-like structure. There's an articulation, a costochondral articulation around about here with each of the ribs, and also another one down on the sternum. So they have this sort of rather lovely chevron-like design. That is so that as they dive, and they dive under exhalation, and the thorax collapses, it allows the effectively you have a shape like this that you need to get flatter, and the more hinges that you put around the edge of a circle, the easier it is to get it to flatten down. So that's an adaptation to help them essentially collapse the rib cage, and obviously then spring it back open again passively when they come back up to the surface. You can see the beginning of the muscle bellies here, beyond the diaphragm, dorsal to the abdominal cavity, which begins here. And then you've got the muscle, the quite thin sheet of muscle that covers the abdominal cavity around here. So take a moment to just assess this. It's really worthwhile to spend some time getting that visualization before you go into the thoracic or the abdominal space. It takes not much longer than it would do if you had a much smaller window, but it gives you a lot of opportunity to see what's going on. So I'm going to make a small incision just at the very edge of the last rib, and then pick up the back of the diaphragm, and again keeping the blade as flat as possible, and visualize into the abdominal space. Small cyst here, small tapeworm cyst, probably monovigmia species. That's in the connective tissue of the body wall. So these are, yeah, small parasitic cysts, white in color. Quite common to find in this species in older animals. If you collect parasites, then take them and stick them in a bit of alcohol. Again, just the dorsal body wall here, dissecting down through the muscle layers, checking for bruising, hemorrhage within the muscle layers themselves. You can see here, testes, trying not to another cyst. And the tapeworm cyst here. You just get a photo of these, Nick. Yep. No. So underneath the testes, we'll see this is actually buried in. So that's the bladder. Okay, that. So be careful when you're dissecting back down again to try not to enter the bladder, so that the bladder's intact here, but it is also empty. Um, Usually, if they've live stranded as this is, they void their their bladder during the stranding process. We can try and take some urine from this. The easiest way to do this is to put it under a bit of tension and just make a small incision towards the distal end of it, and introduce a pipette and see if there's any liquid in there at all. Very little. Can't really do very much with that, unfortunately. So no really bladder contents there. We can take a section of the bladder, however, for histology. So this is how we collect our histo samples. This is a bucket with 10% buffered formalin in, and we just put all of our samples into that, all mixed together, and our histopathologist is able to, by the structure of them, work out what is what. If you have something which you need to be able to identify, for example, lymph nodes, where you need a very particular type of lymph node, then we found that this is a quite handy attachment. This is a tea bag. Can be bought from eBay. It's just a unbleached, I guess, parchment membrane, highly permeable. What does it say on that, the back of that label? No, it doesn't. Oh yes. So that's probably not the main idea that they have for using them, but they work really well. So you can put your tissue sample in that and write in pencil on it what that tissue sample is, and then the histopathologist knows which lymph node it happens to be, or which slice of testes, or etc. So those are helpful things to get. Again, just heading further back, visualizing as best as possible. Then some more parasitic cysts in the pleural lining, but not much else. A bit of fluid, that's probably from post-mortem change. And then I tend to just move forward and go through the articulation of the ribs, if possible, at the top, where they articulate onto the spine. Now, depending on how old the animal is, that can be either easy or difficult. Yeah, this is going to be difficult, so we might need some loppers for that. Yeah, what? These are just a pair of gardening shears, which actually work remarkably well at just, it's all possible. I try not to do this, partly because it makes it hard for the carcass to be, the skeleton to be rearticulated, obviously, and also because it leaves some quite sharp fragments of bone. But in this case, this animal is old enough that there is actually, it's quite hard to disarticulate that. So be really careful as you're moving forward with this, because these fragments of bones are now quite sharp, and you're more likely to cut yourself on a fragment of bone, I think, than you are on a knife. So you can see we're entering into the thoracic space. just the last, so that those cranial ribs are often the most awkward to get flexion in. That's one. Okay. Right. So again, be really careful as you're reflecting this back. And you can now see quite nicely these articulations I was saying. So the chevrons that come down here. You have the rib here, one articulation, and then the rest of the bones going, heading back cranially again. You'll probably find it's easy to cut through these at the costochondral junctions. You won't need to use the saw on these. You should be able to just cut through them relatively easily with a knife. No, I think these are okay. You just feel where the main part of the joint is, and the advantage of doing this is these are now nice smooth edges. So if you're going to be working here, you don't want to have sharp points here that you can catch yourself on. Okay, so just have a quick assessment of the inside of the thorax. So that would have been like this. So we just essentially now articulated it out like that. So look for any swellings or hemorrhages within the costochondral muscles. Not very much to see here. Obviously see if there's any adhesions where the lung might have stuck to the thoracic wall. Again, not in this case. It's all nice and clean. Very nice, sort of slightly shiny pleural membrane there. So that's all pretty good. Nothing really remarkable there. We can put that for the museum. And just before we go through the anatomy, I'm just going to take another bit of this. So the musculature, just removing this so we can visualize things a little easier. This will allow us to see the dorsal abdomen contents a little bit easier, mainly the liver. And going around the hyoid. Moving the strap muscles out from around the hyoid. You should be able to disarticulate this, just where it attaches at the dorsal side. Tongue. Often quite a lot of blood around there. Right, leave that for now. Could you get me a bucket with some water, please? So just we'll have a quick go over the anatomy now. We've got some pretty good visualization. So yeah, plonk it down there. Perfect. Thank you. So obviously, starting at the rostral end, the head end, this is the tongue, which we've partially resected. which goes into the pharynx, and as you go further back, you can see if you go through the lateral wall of the pharynx and the hyoid apparatus, you can see the goose beak, which is the articulation. Oops. Hang on a minute, just need a bit more. So you've got the goose beak attachment here, which goes up into the blowhole. So that, check to see whether there's any material that's either side of that, any fish, any reflux, stomach contents. That goes down into the trachea, and that goes into the airways. So it's sort of crossover that enables air to get from the blowhole down into the respiratory tree, and for food to get from the mouth, obviously, into the esophagus. So we'll spend a bit of attention on this in a moment, but for now, we'll just look at the general anatomy. So this is now going into the thoracic cavity. You've got the, this is the left-hand lung, obviously, quite inflated. There should be an intact mediastinum, so you'd have the puncture to go through into the right-hand side. So worth paying attention to see whether or not either are under negative pressure, whether any pneumothorax. Check to see whether there's obviously any fluid, any blood. This is why it's worthwhile doing them on right lateral recumbency, because this is the aorta. So it's good to be able to visualize the aorta from this side. The aortic bulb, smaller in this species than beaked whales, and larger deep diving species, is massive. And underneath this, you have the pericardium, which we'll sample in a moment to get some pericardial fluid. So there's the heart, there are your lungs. Diaphragm, as I say, are very oblique. It attaches further dorsally. It's much more chordodorsal, so it's this oblique angle. I'll just remove some of the tissue from it so we can see what's underneath a bit easier. So into the abdominal cavity, obviously the first thing you're going to come to is the liver, right up against the abdominal cavity, and mainly on the right-hand side. So again, it's quite a large organ, quite a solid organ. So again, by going in through the left body wall, you're able to have most of the liver out of the way. From this viewpoint on the front side of it, you can see the various stomachs, and these species have effectively 3 stomachs. So this is the first stomach, the outpouching of the esophagus. It's lined with white keratinized tissue, and it essentially grinds the food up before ejecting into the second stomach, the fundic stomach, which is, to intents and purposes, like the stomachs in monogastrics, low pH, high mucus, enzymatic, where digestion occurs, and then passes through into the pyloric stomach, which you can just see underneath here, which allows for the mixing of the digestive enzymes with the pancreatic and gallbladder and bile. The stations don't have a gallbladder, so there's constant production and flux of bile acids and bile into the intestines. If you find the animal hasn't been feeding recently, often there's quite a lot of reflux bile in the pylorus, and sometimes even further up into the other stomachs. And then that feeds into the beginning of the small intestine here. This is the pancreas, and you can see that this has got some small gas bubbles in it. The pancreas, being very enzymatic, tends to go off very quickly. So that's probably post-mortem change there. That's pretty typical. It feels a little bit like bubble wrap, but unfortunately that's probably that's not pathological. That's just post-mortem change. This is the spleen. So the gastrosplenic ligament there, and the spleen attached onto the side of the stomach. Smaller than you'd perhaps anticipate for compared to terrestrial animals, because although this has white pulp and red pulp and has a blood filtration and hematopoietic function, most of the blood storage functions that you would see in terrestrial animals that the spleen fulfills take place in the muscle. So the splenic tissue insertions can be much smaller. You'll then see this heavy root of the mesenteric root attaching the small and large intestines, and within that you'll be able to feel the mesenteric lymph nodes. Now these are often quite enlarged, particularly in juvenile animals, which would make sense because a lot of the prey that they eat, the antigen presenting cells, the first time that they meet the various antigens, parasites, bacteria and viruses carried by their prey will be through these nodes here. So these are often quite reactive. Check the mesentery, look for any bubbles, any petechiation. You can see this intestinal mesentery here looks really rather nice. It's the mesentery wall itself is nice and translucent. You can see through it. There are no adhesions. There doesn't seem to be any evidence of any fluid. You can just about make out the lacteals here, which are draining. There's a little bit of tissue in here within the lacteals as they're draining out of the intestines up towards the mesenteric root. They often carry quite a lot of fat as small chylomicrons, so little tiny fat globules which look white. So the lipid and fat in the lacteals will make them appear to be white. So that can be a useful indication if they're very prominent that the animal has been feeding relatively recently. These not so prominent, so I suspect not feeding for a while. You can also feel the intestines. There's not a huge amount of content there. All that we can really feel in here is just gas and air. Well, gas of some nature. So just reflect that slightly out of the way, just to show you the other tissues here. Whoops, try not to lose it. So these are the kidneys in the dorsal body wall, paired, and just cranial to that, there's the adrenals there. Those are worth taking out to assess the chronic stress of the animal, but be quite careful when handling adrenal tissue because they can be quite susceptible to crush artifacts. The kidneys are these rather beautiful multirenal kidneys that all cetaceans have. You can see here there's the various different, each one of those is a little renule in its own right, has the same structure as a Uriah's kidneys, but they're little bunches of grapes. So they have multiple ones of those. Adds a great amount of spare capacity. Effectively, if you scaled up one of our kidneys to the size of or certainly a large cetacean, the physiology just simply wouldn't work. So this is a good indication of that you have in larger animals, terrestrial and marine mammals that have this sort of renule structure. Going further back, you've got the testes, so symmetrical. They look fairly active. There's a parasitic cyst on the epididymis of this one, it looks like. But we can take those out, measure and weigh them, but they seem to be relatively active. We'll tell histologically whether or not there's any seminiferous fluid in there, and we've already looked at the bladder. The penis is in this structure here. It's to extract. So that's basically your main organs, and we'll obviously go through them in a lot more detail now, but just it's worth taking a bit of time to just appreciate them, look for evidence of, certainly in the both thoracic and the abdominal space, see whether or not there appears to be any fluid accumulation, particularly hemorrhage. Are there any abscesses? Does it look like any of the tissues look particularly consolidated? Or they will probably be congested. They'll probably have quite a lot of blood in them, but try and feel to see whether or not any of them feel to have focal areas of consolidation, particularly around the lungs, because pneumonia is quite common in these species, and in the liver. And before you get too carried away, have a look at these. But also before you kind of guddle in there, it's a good idea to now take your samples, particularly for bacteriology and virology, because it's good to get those done before you start changing the tissues too much, particularly those that are particularly sensitive to handling, such as like the adrenals and the lung tissue. So we'll do that now. Okay, so I'm going to start with so we take samples from the lung, the spleen, the liver, and the kidney for bacteriology, along with any other organs, but eventually the brain as well that we want to examine. And for the purposes of this, we'll just take so Nick, you can come and sort out the brain, the lung tissues. So we cut these into various different bits. This is a chunk for bacteriology. Another lung. For histology. And then some much smaller pieces for frozen tissue archive. Feel just on the cranial edge of the lung. There's some lymph nodes, the associated nodes here. Not very reactive at all. Some species are more obvious than in others. They're present, but nothing too much. So put those in histology as well. This is often a good time to collect the pericardial fluid. No, that was a pulmonary-associated lymph nodes. So you can see if you just reflect the lungs dorsally, you can see the pericardial sac here. There's a bit of fluid here, which is just, I think, the blood leaking out of the various incisions we've made. So again, have a pipette, pick up a corner of the pericardium, and then collect some of the fluid. This is really useful for as a serum analog. Often will be quite blood stained. If you can, good to try and spin it down to get some of the blood out of it. But if not, just keep it chilled. So once you've collected the samples, you can then examine pericardial fluid, check the nature of it, look to see if there's any adhesions, check to see if there's any, obviously any fluid that looks a bit abnormal, be able to pull the heart out properly, but it's worth just examining it briefly in this. Also check the thickness of the pericardial sac. It should be relatively robust, but it shouldn't be too thickened, and it shouldn't have any nodules or irregular feelings to the surface. Next organ I'll take is the spleen. It's here. So remove the entire spleen. Sometimes there are a few accessory spleens that will be attached in a similar place. Massive in this case. And similarly, look at the cross section. You won't be able to see much in terms of the ultrastructure difference between the red and the white pulp. That's much easier to discern histologically, but it's worth just having a look. Also look to see whether or not there's any petechiation on the outside of the sphenic capsule. sometimes you see ecchymotic to almost like slightly raised plaques, blood plaques. They seem to be relatively normal in some species. I don't think they tend to be associated with very much pathology. Again, we take more samples of this for the ultra-cold archive. In triplicate. So that's for spleen. Formless. We can assess the pancreas. Let's say it's quite autolyzed. Lots of bubbles. Probably not worth sampling for histology, unless you can find a bit that doesn't look like it's too decomposed. There's a bit there. So there's a bit of reflux bile, some pancreas. So just underneath here, you'll find some liver. Now there's a lot more liver than appears to be here, but we'll just take a small section out. Immediately you can see how congested that is. Lots of blood pooling, probably perimortem, but interestingly, check the color. It seems to be a good kind of dark purple, dark red color. There's no clear evidence of fatty change. It doesn't appear to be greasy. It doesn't appear to be tan colored. It doesn't look like there's significant parasite burdens, at least not in that little fragment you've got. So assess the rest of the liver in much more detail. But this is a useful organ to take samples for both histopathology but also toxicology. We'll put our I'll have, I don't mind. What's yeah. I'll get a slightly bigger chunk for bacteriology. Okay, bacteriology. So we collect big chunks of tissue that we freeze down, and then we'll in the lab defrost, make a very small incision in, and do the bacterial culture from that. It is possible for you to just take swabs at this point, but we find that the bacterial recovery rate from swabs, once they've gone through the freeze process, can be quite compromised. If you have a bacteriology lab which is in your post-mortem room, which ours isn't, then that makes things a lot easier for you to be able to take the bacteriology and get it cultured up pretty much immediately. So 3 liver samples. You can see how congested this is. Very dark red color. And then there's a couple of bits of liver tissue here, which are useful to collect for toxicology. So we've got the skin, muscle, and blubber for toxicology, and now got liver. In terms of isotopes, the isotopic profile in your liver is probably the representative of what the animal has fed on most recently, other than perhaps blood serum, which isn't available or not easily available because it's clotted. So in terms of the chronology, you have your liver tissue, which is really contains the isotopic profile from the last few days, if you like, skin to maybe weeks, and then muscle is towards months, and bone is potentially up to its entire lifetime. So the different tissues that you can collect can give you a profile of the isotopes of what they've been feeding, where they've been feeding, how well they've been feeding, perhaps over the recent and not so recent history of the animal. So by collecting these different tissues, you can freeze them, so you can keep them in the freezer for years potentially, and then still, when you get the funding and the opportunity, you can then run those analysis. So it's very worthwhile taking them. They're good tissues to have. Okay, so heading further caudally, I'm just going to remove the adrenals before we lose them. You often can feel these more than you can see them. So very gently dissect out the view. Obviously, this is a kidney here, so just at the cranial pole, you'll be able to feel and remove the adrenal gland and handle it very carefully so that you don't get too many pressure artifacts. There we go. So that's the left adrenal. And very carefully with a very sharp knife, make a single incision through most of the capsule, and that will allow you to visualize both the adrenal cortex and the medulla. You'll need it on the macro setting. So the difference between the cortex and the medulla, if you've had chronic stress, I don't mean the stress associated with the stranding, but sort of physiological stress from nutrition, reproduction, then you might find that the cortex is slightly more hypertrophied than the medulla. You can get medullary hypoplasia and cortical hyperplasia. Again, easier to assess histologically, but and not really something that you could sort of hang your hat on, but could potentially be a useful indication of chronic stress in these animals. To be honest, in that case, that looks pretty normal to me. So just here going into the right side of the lung, you could hear the negative pressure there. And then you should probably be able to find the other adrenal, often more by touch. There we go. This one's a little bit more heart-shaped. Some renal tissue on it. But that's slightly wonkily, so I might leave that for the histopathologist to recut. And I've left a piece of kidney on there, just also in any doubt what it is. So with the adrenal safely away and fixed, you can now remove the first kidney. Check to see whether or not there's any clear evidence of bubbles. Sometimes you get some pericapsular emphysema, can be related to decomposition, and sometimes the stranding process, particularly if you've got lung emphysema, it seems to be able to track through the fascia and around the kidneys. Maybe a little bit, but nothing too significant. And again, kidney tissue good to collect for bacteriology. Five into formalin. Tend not to see very much renal pathology, to be honest. There's sometimes in the larger whales you can see verminous arteritis, Crassicorda species that can be quite significant, particularly in some of the larger baleen whales. But generally speaking, the kidneys don't show you that much, other than if you've had an animal that was live stranded or stranded multiple times, you can sometimes see effective myoglobin build up in the cortico-medullary junction of each one of the individual venules. It's hard to see in this one. This is actually moderately there's some decomposition processes that have started to kick in here. So it's going to be quite hard to be able to make it out. But histologically, it should be possible to see whether or not there's any accumulations of myoglobin in the kidneys. Now, obviously, myoglobin, free myoglobin from the serum released into the tissue from the breakdown of muscle, probably as a result of stranding or capture myopathy, is pretty toxic. And sadly, we see cases with quite a lot of myoglobin urea, so the urine dark red color, and you can very grossly on those, you can often see quite clearly the kidneys that have been pretty much occluded with buildup of myoglobin. So keeping the urogenital tract, we'll just remove and weigh and measure the testes. So this is the F1. So in terms of measuring the testes, get a photo of the length of them. Camera, please. And you can see there are some these parasitic cysts around the epididymis. They look like they're relatively active, this. Take a couple of slices. If it matters for you to know which is left or right, you can measure them, but if not, we'll just put a slice of each in. With the camera, please. We'll take a photo of just the cross section. Thank you. So what I'm going to do now is just remove the pluck, if you like. So you dissect just through the membrane here, you should be able to see just under and slightly ventral to the aorta, you'll be able to see the esophagus. Dissect around the aorta. tend to cut across the esophagus, just at the back of the pharynx. And then you can put a bit of traction on it and just pull back. So this is the diaphragm, this is the back of the diaphragm. You can cut through the diaphragm. And then that'll be the back of the stomach. Now what you'll be able to see as you cut through this is you'll go through the major vessels, the caudal vena cava, main bile ducts. Bit of pancreatic tissue. That's the main portal vein into the liver. The bile there, so that's leaving the liver behind. Now you've then got the back of the stomach, bit of pancreas there, various chambers of the stomach. You can just reflect this all back out of the way. So trying not to lose any of it on the floor. So that leaves you with the pluck, the lever. You take the pluck out, so grab hold of the tongue. Now, you should be able to feel just at the back of the hyoid, the thyroid. And it again is one of those structures that's often easier to feel than it is to see. And again, handle these very gently. There's a bit of your thyroid tissue in there. Again, doesn't look, pretty much looks the same as muscle, slightly different on cut section. So that's your thyroid. Yes. The pigment change the back of the tongue. Proximal esophagus looks pretty okay. And then should be able to just pull. Oops. Maybe that doesn't happen. You've now got the pluck, the main airways, and the heart, very congested, a lot of blood around here. So I tend to just remove the heart at this point. And then what you're assessing is the symmetry on the lungs. You can see this side much more congested. Now, some of that is post-mortem, but I think probably a significant bit of it isn't. So I think this isn't the hypostatic congestion post-mortem. I think there might be some actual ante-mortem congestion with this, which would fit with what we know about this animal having live stranded and spending a bit of time on its side. So I'm taking a bit of this lung, very congested, lower dependent lung, putting that into formalin. And then giving it a shot of that next. So in some cases where they've been on their side for some time, you have the lower lungs had all the blood pooling in it. It's very dark color, lots of blood, very similar to this. The upper lung is often bigger, hyperinflated, sometimes quite pink in color, much bigger. And if it's had to do a lot of work and there's been a lot of respiratory stress, sometimes you actually find that it's so inflated that you've got some interstitial emphysema. It's opening the aorta, checking for any parasites, clots, nothing really significant there. And then opening the airways. Looking for stable foam, you can see a bit of there. Probably aspirated some seawater during this process, quite wet. So we've got some stable foam here, some clots in the upper lung. No real parasites that we can see. Lots of congestion, lots of fluid. Probably would fit with this. We suspected the animal aspirating some water around the fattening process. But what we can't feel is any clear consolidation. So lungs generally seem to be okay. There's some pathology related to stranding, but there's not a huge amount of pathology that I can see that was there much prior to the stranding process. But both pretty dark. We know that this was one of two animals that were seen circling in shallow water, and they were monitored for a couple of days before they were both seen to have stranded at high tide. So we know they were alive in the area, and then we know that they were found dead in the same area. So we're relatively confident that they live stranded. We just during the night, and probably due to the amount of fluid that we can see in the bronchial trees here, that they aspirated seawater during that stranding process. So this is pathology that's consistent with the stranding. It doesn't give you a huge amount of insight into what happened beforehand, other than it helps you rule out significant pulmonary pathology and pneumonia as being a factor in the animal stranding. Some species have very, very high levels of parasites, nematodes, Pseudalis, Helicircus, nematode species, but there's actually very little in this that we can see. Now the heart, I tend to just wash this, to be honest, so you can see what's going on, because otherwise everything is just very, very blood covered. So assessing this, you have the left-hand side of the heart, the right-hand side, you see a thicker wall on the left side than the right. Main coronary vessels. Look to see if there's any petechiation around the cardiac myocardium, assess, see if you can find any fragments of thymus. Generally, there's nothing too unusual that you can see here. You can open down the aorta. And go into the left ventricle. And then that allows you to assess the state of the valve. Yeah. Check for any endocarditis, endocardiosis, valvular integrity. Any in younger animals, any changes to because there are patent ductus arteriosus. Do you have a septal defect? Are there any structural abnormalities, which are rare? I've seldom seen them. Then I take a bit of the chordae tendineae and these pili muscles for histology. Along with just some fragments, sections rather, of ventricle myocardium on the left and the right side. But again, cardiac pathology is relatively uncommon that we've found. I think cetaceans smoke less and drink less than we humans do, so they tend to have much healthier hearts. So yeah, it's pretty normal. So I don't quite intend to take this part of the thorax out. So the goose beak and the proximal trachea, just for completeness, you can open those. There's some stable foam there, but no other real structures there. Tonsillar material. See if there's any unusual pathology in the tongue, which again, very seldom to find. Okay, so we now remove the liver, and as you can see, the large main lobe of the liver occupies the right-hand side. So you can assess it here. Just the color, very congested. Again, the congestion probably related to the stranding. So take a sample of this for histology. So we've got various bits of liver from different parts of the organ. Yeah. Aside from the congestion, there's not very much there. Please check the second kidney. Nothing particularly of interest there. Take a sample for histology. Okay, so You see, we've got most of the organs out of this. The next stage is to assess the GI tract. I tend to leave until towards the end. Okay, so what I tend to do here is just collect some fecal material. So dissect far back as you can easily. And you can grab hold of the rectum and I tend to milk the fecal material proximally for a bit. We can cut that. We can move the entire GI tract. You can already feel from just the weight of it, there's not very much, not very many contents in it. Can I get a pot now? There's some, but not a huge amount of fecal material. But that's useful for obviously parasitology, but can give you some information on exposure to harmful algal blooms. If there's no urine, then it's a very useful sample to take. Not a particularly pleasant one, but will give you parasitology, and you can use the ELISA tests that are suitable for looking at urine with an extra kind of cleaning stage. Those same tests can be useful for running ELISAs for harmful algal bloom, things like domoic acid and saxitoxin levels. Could I get the pot back? There's a little bit more here. That's good. So with the fecal samples taken, and now go, so that's the esophagus, cardiac stomach, fundic stomach, so cardiac stomach, fundic stomach, pyloric stomach, intestines. So as you're opening them, you're looking for stomach contents. Obviously, you're looking for parasites, marine debris, evidence of recent ingestion. So this is the first stomach. See the sort of slightly keratinized epithelia. Not very much contents. Some perhaps clay material there, but nothing much. So this pasty tissue could be actually digested. It doesn't seem silty though. It's not silk. It's definitely, it smells quite fishy. There's probably some clay remnants, but not very much. Now, that doesn't mean that he wasn't eating, because often during the stranding process they can vomit. So it may well be that they're what you're seeing here is just whatever was essentially still stuck to the stomach lining. Obviously, it's much more placated, so it's if you've got slightly adhesive ingestion here, it will stick. But what we're not seeing is any significant parasite burden, no anosarchis, no volcano lesions, no as in ulcers within the stomach wall of note. Pancreas again, saying quite autolyzed. Have you got a photo of this, Nick? Yeah. Have you got a photo? Hmm. No. So the reason it's useful to know about the stomach contents is that if they've been in shallow water, then they might have been in shallow water because they were following prey. So assessing the stomach contents, like tails, the intestines, give you an idea of what might have caused the animals to come in. So of pelagic species like this, in the shallow waters around Shetland, it's not unheard of. It's not an abnormal place. They're not out of habitat there. It could be that they followed some prey in and they got stuck in a falling tide in some complicated kind of coastal landscapes. That happens, they end up getting stranded. In those cases, you tend to see that they've been feeding and feeding recently. Similarly, for bycatch cases, often bycatch cases have a very high level of recent prey because they'll have been feeding right up to the point to which they get caught in the net. So there's it's useful. The stomach contents will not only tell you what they've been feeding on, but they can give you some indication about why they might have been in the region close to where they're stranded. So going through the rest of the stomach, we're now moving into the fundic stomach, the second stomach. We say this is the glandular stomach. Not very much in here at all. No, bit of fluid. Slightly bile stain. So a bit of reflux bile here, perhaps. And certainly looking now from the pyloic stomach, there's a lot more bile here. So this sort of greeny color to the bile is good indication that they've not been feeding for a while. As I say, they're just continually producing bile from the liver, and if it doesn't have anywhere to go or to conjugate onto, then it just sort of builds up in the stomach and the proximal intestine. Yeah. Bit of ingestion, but not very much at all. So, in order, first stomach, bit of fish remains, but nothing much. Second stomach, fundic stomach, largely empty, abyss of bile, not very much. And then we're into the pyloic stomachs. And here we just got a bit of fluid and bile. No significant volumes. And you can see as you're going in then out of the pyloic stomach and into the proximal intestine. So going through into the out of the stomach and in through the sphincter and into the proximal intestine. Again, there's bile, but not very much else. Not a huge amount of fluid, and that would fit with what we were seeing in terms of the animal being dehydrated, or a little bit dehydrated, and also the observed behavior before it stranded, of swimming in tight circles, not really foraging, didn't appear to be exhibiting much foraging behavior from the drone footage that we had in the 24 hours before it stranded. So you can open the entire intestine, but speed for the purposes of this, I'm just going to open some little windows into it just to look for parasites, which there seem to be none so far. But I can see, look for marine debris. Obviously, it's worth checking for linear foreign bodies, fish hooks, for example, that can concertina the gut, but you would see more changes with this. And obviously check areas of the gut, see whether or not there's any evidence of petechiation, any evidence of infection. Not really very much at all. It all looks not been feeding, but basically apart from that, relatively normal. I can come back to that after and have a bit more of a detailed look, but for now, I'm happy that we're not missing anything major there. Okay. So the last thing to do is to take the head off, because what we know about this animal is that it was seen swimming in tight circles. There was another animal with it, and we're not sure which one was helping the other, if you like, or they were both sort of exhibiting normal behavior, but the abnormal behavior was probably seen in the other one. This one was thought to be helping its podmate. And the thinking is that the other one was the one that had the pathology, and this one was trying to, if you like, assist it. So, but we may be wrong with that. It could be that this also has some pathology. Haven't seen very much internally that would lead us to think there's a major problem going on. Parasite burden is low. There's no feeding, but blubber reserves are reasonable. A lot of changes to do with post-mortem and changes to do with peri-mortem to the stranding process. But as far as finding a causal reason why this animal has been in here, doesn't appear to have been following prey, doesn't appear to have been significantly sick in terms of visceral pathology, doesn't appear to have necessarily been exhibiting breeding behavior. And then we'll see whether or not the testes were actually producing sperm. Some evidence of stranding, but again, that was probably agonal. So that all leads us to think that we might need to look at the brain in some detail. So hopefully that will be in a condition where we'll be able to look at it both grossly and histologically. So the next part of this is to get the head off. Right. So the back of the skull, you can feel from the blowhole. You can see the articulations. You move the head up and down. You can see the point where the skull is. Just dissect your way down. You can remove some of the muscle, which will help visualize. Eventually, you should be able to feel the articulation of the hyoid apparatus. You can just pop through that. Now, when you're taking the head off, it's useful to have somebody ready with a pipette to be able to take any cerebrospinal fluid. the technique. Going down the back. So that's the occipital condyles there onto the spine. And then so occipital condyle and obviously spine there. Now, if you can get a pipette into the back of the brain, and that will allow you to collect any CSF. Now, in some species, you can get very large volumes of CSF built up if they have neurobrucellosis, and to the point at which when you take the back of the skull off, it often leaks out all over the floor. There's just blood. You see, not a huge amount. Well, an animal that's been dead this long will have some blood contamination in there, but that's still useful for culture. So you can still take that sample, culture it up to look for Brucella celiseti, and potentially look to see if there's any turbidity in it. We can look at it in a bit more detail once we take the back of the skull off. So for this like medieval torture device that we made, this is just a normal woodworking vise that we screwed 2 pieces of board to and some spikes. I think originally used to support music speakers. I suspect they were never anticipating using this for. Okay, so the various ways of taking the brain out, what we do is we just go down here and then perpendicularly at 90 degrees across here and take this entire back section of the brain out. You obviously cut through the brain doing that, but that is actually useful because it allows you to visualize the internal structure of the brain whilst it's still in the brain case. And the brain of an animal this size is far too big to fix whole anyway. You'd never get the perfusion, so it helps. The first cut. Second one down. Try and get that as perpendicular and as straight as possible. Okay, there's been one incision down there, one across there. What's the prevalence of Priscilla in Atlantic whiteside snake? Section of brain off 14. Should you just run your knife over the top of, allows you to visualize the brain. Oh, something went through. Oh, you did. So what we're looking at here is I've obviously taken this section of the brain off from here and just cleaned up the tissue. Now, clearly we'll need to assess this histologically, but you can already see there's a very large amount of white matter, which is an indication of age-related changes. So a lot of white matter here and here. So this is an old boy. Looking here as if there's any elevated cerebrospinal fluid. Trying to remove the cranial nerves. Cut through the cranial nerve, clear up the brain. Okay. So there's a small amount of hemorrhage, just blank hemorrhage within the skull. That might just be related to the stranding process. That's the frontal lobes. Some postmortem change. Not a huge amount of deviation or anything particularly obvious with this. Bit of hemorrhage there, but no clear sign of meningitis. Meninges look a little bit sort of tacky, but not too thickened. So a lot of that's the ventricles, and they are not very much in them. They're not as dilated as we would see in some cases. No real excess cerebrospinal fluid in there. Bit of fluid down there, Nick, if you want to try and grab just a bit. Okay. So if you can recover a bit of the CSF fluid, it's really useful to use that to culture. But effectively, all we can see here is just a lot of white matter. much, but you don't need much, but that's really useful because that doesn't have any blood staining in it, so that's just the cerebrospinal fluid. So it should be useful to culture that one up. We'll take a sample here of the obex for culture and a bit of the cortex virology, which we also try and take some of the meninges with as well. So these will be bacterial culture and then for ultra cold archives. So yeah, so these are the choroid plexus, those purple sort of slug-like things in there. Those produce the cerebrospinal fluid that bathes the brain. If there's an infection in the brain that has impairs the drainage of the cerebrospinal fluid, then you get a hydrocephalus, a buildup of pressure, and that's what dilates your ventricles. And one of the things that we've noticed in this species and several other cetaceans that will do that is, as I say, Brucella. So Brucella seti, which is actually not thought to be zoonotic to humans. There's very, very scant evidence in the literature of humans ever becoming infected with Brucella seti. It does happen, but it's rare, very rare. But it is a zoonotic, potentially zoonotic organism. And often laboratories will have constraints on what they can culture up because of the concern about Brucella. Cetacean Brucella is different species to cattle. Melitensis and abortus are the ones that we need to be concerned about for zoonotic risk and for livestock risk. Different species, seti, and in some cases pinnipedalis, that affect cetaceans and seals. But nonetheless, you will need to check to see whether or not your laboratory is concerned about Brucella before sending them samples for culture. Okay, should we get some tissue samples? Give you some more than that. So we take bits of brain for bacterial culture, for virology, obviously for histology, and some of the cortex for toxicology. So this is a very lipid-rich tissue. So it's you've got a bit of hand range. That is that. That's from there. Okay. And then so it's a spinal cord, whole brain, and they look kind of macerated like this, but as long as they're open enough that you can be confident of fixation, then you'll be able to get the samples that you need. And ideally, if you have enough formal enough space, fix the brain whole. Once it's been fixed for a few days, you can take it out, slice it into the requisite samples. But there's most of your pathology, if you could choose two organs that you should look at histologically, one will be brain, the other would be lung, because between those two, ideally look at more, right? But if you could only look at a limited number, those are really useful ones to look at. They'll give you good insights into both the health of the animal and some significant pathology, potentially some causes of significant pathology that can relate to the stranding. Okay, so we made a bit of a mess of this. I think we'll probably call it a day here because there's a few bits and pieces to do, but I think you've probably got the gist of it. I guess the last things to say are that if you would like to talk through any of this, then please get in touch with ourselves or Emma through the IWC. We should be able to get the results of this relatively soon. In terms of conclusions from this, aged animal, live stranded, no significant underlying pathology, but no that was obvious, but no feeding either. So it might be a degenerative change. It might be that the animal's got lost. It might have been following its friend in, and the other one might be the one that has all the pathology in it. But again, well, a lot of this is about ruling things out as much as ruling things in. We've got a load of samples that we can use for subsequent analysis for bacteriology, virology, and histopathology. They will give us more detailed insights that we weren't able to detect from this. In addition, we will have samples of toxicology, which will get processed, maybe not even this month, let alone this year, let alone this month, but we have those in the archive. They're in our freezers that you can see behind us over there. And most of this will go into sort of feeding our larger database. So the advantage of these sort of detailed necropsies are not just to understand the cause of death or what happened to this animal, but also to collect data and samples that are useful about what happened to animals in our waters, this species, these populations, potentially the ecosystem that they're from. And on that optimistic note, I'll bid you farewell. Thank you for listening, and be in touch.